The time between drug administration and beginning of its effects is called duration of action, latent period, off-life, peak effect. The correct answer is option B, latent period. Latent period is the time interval between giving a drug and the first observable response. The time between drug administration and the beginning of its effect is called duration of action, latent period, half-life, peak effect. The correct answer is option B, latent period. Latent period is the time interval between giving a drug and a first observable response. The time drug which a drug continues to produce its effects is duration of action, onset of action, half-life, latent period. The correct answer is option A, duration of action. Duration of action represents how long the drug maintains its therapeutic effect. The main aim of pharmacotherapy is to cure diseases using surgery, use drugs for prevention and treatment, diagnose illness only, replace hormones. The correct answer is option B, use drugs for prevention and treatment. Pharmacotherapy deals with the use of medicines to prevent, control, cure diseases. The concentration of drug that produces maximum effect is called effective dose, ceiling concentration, optimum concentration, toxic concentration. The correct answer is option C, optimum concentration. Optimum concentration gives the desired therapeutic effect without toxicity. The relation between drug concentration effect is known as dose response relationship, drug receptor theory, enzyme reaction, metabolic rate. The correct answer is option A, dose response relationship. It shows how the magnitude of a drug effects changes with the varying doses. When two drugs having similar action are together for better effect, it is called synergism, antagonism, potentiation, tolerance. The correct answer is option A, synergism. Synergism occurs when combined drug effect exceeds the effect of individual drug. When one drug increases the action of another, the phenomenon is called option A, potentiation, option B, addictive effect, antagonism, neutralization. The correct answer is option A, potentiation. Potentiation means a drug without its own action enhances another effect. Potentiation. When two drugs produce the same effect and their combined effect equals the sum of individual effect, it is called synergism, addictive effect, potentiation, antagonism. The correct answer is option B, addictive effect. Addictive effect is equal to effect of drug A plus effect of drug B. When one drug decreases or blocks the action of another, it is called synergism, antagonism, potentiation, summation. The correct answer is option B, antagonism. Antagonism occurs when one drug reduces prevent another's effect. The type of antagonism in which two drugs act on same receptor is competitive, non-competitive, physiological, chemical. The correct answer is option A, competitive. In competitive antagonism, both drugs com- compete for the same receptor site. The type of antagonism where two drugs act on different receptors but produce opposite effect is physiological antagonism, chemical antagonism, pharmacokinetic antagonism, competitive antagonism. The correct answer is option A, physiological antagonism. Here, drugs oppose each other by acting on separate receptor systems. When an antagonist chemically neutralizes the agonist, it is competitive antagonism, chemical antagonism, physiological antagonism, pharmacokinetic antagonism. The correct answer is option B, chemical antagonism. Chemical antagonism involves direct chemical reaction between drugs, example, chelating agents. The type of antagonism where absorption or metabolism of one drug is altered by another is pharmacokinetic antagonism, competitive antagonism, physiological antagonism, chemical antagonism. The correct answer is option A, pharmacokinetic antagonism. This occurs when one drug affects absorption, metabolism, or excretion of another. When a drug induces enzyme activity that metabolizes another drug faster, it causes enzyme inhibition, enzyme induction, antagonism, hypersensitivity. The correct answer is option B, enzyme induction. Enzyme induction increases metabolic rate, reducing the duration of drug action. When a drug inhibits metabolism of another, it leads to reduced effect, prolonged effect or toxicity, no change, faster elimination. The correct answer is prolonged effect or toxicity. Enzyme inhibition slows metabolism, causing accumulation and prolonged action. The process of measuring a new drug effect compared to a known standard is called assay, Calibration, testing, comparison. The correct answer is option assay. Drug assay determines potency and biological activity of sample drug. The ability of a drug to produce maximum response is potency, efficiency, affinity, selectivity. The correct answer is option B, efficacy. Efficacy shows the maximum therapeutic effect achievable with a drug. The selectivity of a drug means it acts on specific receptors or organs. It is highly toxic. It is non-specific. It acts everywhere equally. The correct answer is option. It acts on specific receptors or organs. A selective drug targets a particular receptor type, minimizing side effects. Drugs that act on the same receptors and produce lesser effect even at full dose are called full agonist, partial agonist, antagonist, inverse agonist. The correct answer is partial agonist. Partial agonist bind fully but produce submaximal responses compared to full agonist. The study of how heredity affects long response is pharmacogenetics, pharmacodynamics, pharmacokinetics, pharmacognosy. The correct answer is option A, pharmacogenetics. Pharmacogenetics express individual differences in drug response due to genetic variation. The study of natural sources of drug is called pharmacognosy, pharmacology, pharmaceutics, toxicology. The correct answer is option A, pharmacognosy. Pharmacognosy deals with identification and study of drugs from plants and animals. The study of physical and chemical properties of drugs is called pharmacodynamics, pharmaceutical chemistry, pharmacognosy, biochemistry. The correct answer is option B, pharmaceutical chemistry. It focuses on chemical composition, synthesis, and structure activity relationship of drugs. The study of how drugs act on living organisms is pharmacokinetics, pharmacodynamics, pharmacogenetics, pharmaceutics. The correct answer is option B, pharmacodynamics. Pharmacodynamics explain drug mechanism and physiological effects on the body. The study of absorption, distribution, metabolism, and excretion is pharmacodynamics, pharmacokinetics, toxicology, pharmacogenetics. The correct answer is option B, pharmacokinetics. Pharmacokinetics describe how the body handles a drug through ADME process. Absorption, distribution, metabolism, excretion. The concentration at which a drug produces toxicity is called therapeutic concentration, toxic concentration, optimum concentration, minimum effective concentration. The correct answer is option B, toxic concentration. When plasma levels exceed safe limits, adverse or harmful effects appear. The amount of drug that causes death in 50% of test animals is ED50, LD, TD50, HD50. The correct answer is LD50. LD50 lethal dose 50 indicates median lethal dose in animal studies. The ratio of LD50 to ED50 is known as potency therapeutic index efficacy bioavailability. The correct answer is option B, therapeutic index. It shows drug safety margin. Higher values means safer drugs. A drug that interacts with receptor but does not produce any effect is agonist, antagonist, partial agonist, modulator. The correct answer is option B, antagonist. Antagonist occupy receptor sites and block the effect of agonist. The controlled release dose form helps to release drug slowly and maintain constant level. Increase toxicity, rapidly eliminate drug, shorten effect. The correct answer is option A, release drug slowly and maintain constant level. Controlled release forms provide prolonged steady therapeutic level. The term pharmacovigilance refers to option A, monitoring drug safety and side effects, drug production, drug assay, clinical testing. The correct answer is option A, monitoring drug safety and side effects. Pharmacovigilance ensures detection, assessment, and prevention of adverse effects. The process of discovering new drug is known as drug invention, drug discovery, drug formulation, drug assay. The correct answer is option drug discovery. It involves identifying new chemical or biological substances with therapeutic potential. Phase 1 of clinical trials is done in healthy involuntaries, patient with disease, animals, population at large. The correct answer is option A, healthy voluntaries. Phase 1 checks safety, dosage range, and pharmacokinetics in human. Phase 2 of clinical trials determines long-term toxicity, drug efficacy, and short-term safety in patients. Market response, animal effects. The correct answer is option B, drug efficacy and short-term safety in patient. Phase 2 evaluate where the drug work for the intended disease. Phase 3 trials are conducted to determine drug mechanism, confirm safety and effective on large groups, find lethal dose, study enzyme reactions. The correct answer is option B, confirm safety and effective on large groups. Phase 3 trials verify therapeutic benefits before making marketing approval. Phase 4 trials are known as post-marketing surveillance, clinical trials, laboratory research, toxicology test. The correct answer is option A, post-marketing surveillance. Phase 4 monitors long-term safety after the drug is marketed. The unwanted effect Produced at therapeutic doses is toxic effect, adverse drug reaction, idiosyncrasy, allergy. The correct answer is option B, adverse drug reaction. Adverse drug reaction are harmful, unintended effect occurring at normal doses. The study of poison and their treatment is pharmacology, toxicology, therapeutics, biochemistry. The correct answer is option B, toxicology. Toxicology deals with detection mechanisms and treatment of poison effects. A drug that causes fetal malformation is called carcinogenic, mutagenic, teratogenic, embryogenic. The correct answer is option C, teratogenic. Teratogenic causes structural defects in developing fetus. When a drug causes cancer on prolonged use, it is called carcinogenic, teratogenic, mutagenic, allergic. The correct answer is option A, carcinogenic. Carcinogenic drugs can induce tumor or cancer formation. Drug that alter genetic material or mutagenic, teratogenic, carcinogenic antagonist. The correct answer is option A, mutagenic. Mutagens cause changes or mutations in DNA structure. The cumulative effect occurs when drug elimination exceeds absorption, drug accumulate faster than eliminated. Only single dose given, rapid metabolism. The correct answer is option B, drug accumulate faster than eliminated. Cumulative effect leads to toxicity after repeated dosing. The therapeutic dose is dose that produces desired effect, dose causing death, minimal effective dose, toxic dose. The correct answer is a dose that produces desired effect. Therapeutic dose achieves optimum benefit without adverse effect. A loading dose is given to maintain steady state, achieve therapeutic level rapidly, prevent overdose, reduce half-life. The correct answer is option B, achieve therapeutic level rapidly. Loading dose quickly raises plasma concentration to effective level. Maintenance dose is used to maintain therapeutic level, produce quick action, reduce side effects, prolong half-life. The correct answer is option A, maintain therapeutic level. Maintenance dose keeps steady concentration after loading dose. The dose smaller than the therapeutic one used to maintain effect is subtherapeutic dose, maintenance dose, minimal dose, loading dose. The correct answer is option A, subtherapeutic dose. It is a smaller dose that maintains or prevents reoccurrence of disease. The toxic dose is minimal dose, dose producing harmful effect, normal dose, loading dose. The correct answer is option B, dose producing harmful effect. Toxic dose leads to adverse or dangerous physiological reaction. Drugs used to reduce fever are called analgesics, antipyretics, sedatives, hypnotics. The correct answer is option B, antipyretics. Antipyretics lower raised blood pressure by acting on hypothalamic center. Drug which relieve pain are sedatives, analgesics, hypnotics, antipyretics. The correct answer is option B, analgesics. Analgesics reduce pain without affecting consciousness. Drug that produce sleep are hypnotics, sedatives, tranquilizers, analgesics. The correct answer is option A, hypnotics. Hypnotics induce and maintain sleep in insomnia. Drugs that calm the patient without sleep are hypnotics, sedatives, analgesics, antipyretics. The correct answer is option B, sedatives. Sedatives reduce anxiety and excitement without inducing sleep. Drugs that cause loss of sensation are called analgesics, anesthetics, sedatives, tranquilizers. The correct answer is option B, anesthetics. Anesthetics block nerve conduction and produces loss of sensation with or without loss of consciousness. The route of administration depends on drug property and desired effect. Doctor's choice only, patient weight only, age only. The correct answer is option A, drug property and desired effect. Route is chosen based on speed of action, drug form, and therapeutic goal. The oral route is common used because it is painful, convenient, and safe. Expensive for test. The correct answer is option B, convenient and safe. Oral route is easy, safe, and economical, though slow or in onset. The slowest but most convenient route is oral, intravenous, inhalation, sublingual. The correct answer is option A, oral. Oral absorption takes longer, but it is non-invasive and preferred for long-term therapy. Parenteral route refers to by mouth, by injection, by inhalation, by rectum. The correct answer is option B, by injection. Parenteral means giving drug to routes other rather than alimentary canal. The most accurate and fast parenteral route is intravenous, intramuscular, subcutaneous, intradermal. The correct answer is option A, intravenous. IV route delivers a drug directly into the bloodstream for rapid effect. Drug given by the inhalation are mainly used for heart diseases, respiratory diseases, digestive disorders, kidney problems. The correct answer is option B, respiratory diseases. Inhalation delivers drugs directly to lungs for asthma, COPD, etc. The sublingual route is prepared for drug extensively digested by liver with poor absorption, very bitter, irritating to mucosa. The correct answer is option extensively digested by liver. Sublingual administration bypasses first pass metabolism. Rectal route is used in unconscious patient, vomiting patient, infant, all of the above. The correct answer is option D, all of the above. Rectal route is used when oral administration is not possible. The topical route refers to drug applied on skin or mucosa, oral use, intravenous, inhalation. The correct answer is option A, drug applied on skin or mucosa. Topical drug act locally at the site of application. The intensity of drug effect is mainly related to its absorption rate, plasma concentration, elimination half-life, molecular weight. The correct answer is option B, plasma concentration. The effect of a drug depends on its concentration at the site of action, which relate to its plasma level. The maximum effect a drug can produce, a potency, efficacy, duration, latency. The correct answer is option B, efficacy. Efficacy represents the greatest response achievable from a drug regardless of dose. Which of the following route gives 100% bioavailability? Option A, oral, intravenous, intramuscular, subcutaneous. The correct answer is option B, intravenous. Intravenous administration delivers the entire dose directly into the bloodstream, ensuring full bioavailability. The process of movement of drug from systemic circulation to tissue is absorption, distribution, metabolism, elimination. The correct answer is option B, distribution. Distribution involves transfer of the drug to various body compartments and tissues. The first pass effect mainly occurs in kidney, lung, liver, stomach. The correct answer is option C, liver. Orally administered drugs are first metabolized in the liver before reaching systemic circulation. Which parameter measures drug elimination efficiency? Clearance, volume of distribution, half-life, bioavailability. The correct answer is option A, clearance. Clearance indicates the volume of plasma cleared of drug per unit time. The process of enzymatic conversion of prodrug to active form is excretion, activation, metabolism, distribution. The correct answer is option C, metabolism. Liver enzymes metabolize inactive prodrugs into active therapeutic forms. The main function of plasma proteins in drug transport is absorb drug, bind and carry drugs, neutralize drug, metabolize drugs. The correct answer is option B, bind and carry drugs. Drugs bound to plasma proteins act as a reservoir and release slowly into tissues. Drugs that cause abnormal fetal development are called carcinogens, mutagens, teratogens, allergens. The correct answer is option C, teratogens. Teratogenic drugs cause congenital malformations during pregnancy. The dose needed to maintain steady plasma level is loading dose, maintenance dose, toxic dose, subtherapeutic dose. The correct answer is option B, maintenance dose. Maintenance dose keep the drug concentration within therapeutic range. The movement of drug molecules across biological membranes is by diffusion, osmosis, filtration, suspension. The correct answer is option A, diffusion. Most drugs cross membranes by passive diffusion from high to low concentration. Drugs acting without binding to receptor act by physical mechanism, chemical antagonism, enzyme inhibition, immune response. The correct answer is option A, physical mechanism. Some drugs act physical, example antiacid, neutralize acid without receptor binding. The main factor influencing drug absorption from the intestine is blood flow, lipid solubility, urine pH, temperature. The correct answer is option B, lipid solubility. Lipid soluble drugs easily cross biological membranes, enhancing intestinal absorption. The availability of drug to produce maximum response is its potency, efficacy, affinity, selectivity. The correct answer is option B, efficacy. Efficacy represents the maximal response achievable from a drug regardless of dose. The concentration of drug required to produce 50% of its maximal effect is ED50, LD50, TD50, MD50. The correct answer is option A, ED50. Effective dose 50% is measure of drug potency. The ratio between lethal dose and effective dose indicates efficacy, safety margin, potency, bioavailability. The correct answer is option B, safety margin. The therapeutic index LD50 divided by ED50 represents the safety margin of a drug. Drug that causes sleep are known as analgesics, hypnotics, sedatives, stimulants. The correct answer is option B, hypnotics. Hypnotics drugs induce sleep or drowsiness in higher doses. The study of genetic influence on drug response is pharmacogenetics, pharmacokinetics, pharmacodynamics, pharmacognosy. The correct answer is pharmacogenetics. Pharmacogenetics studies how genetic variations affect individual drug response. The study of drug absorption, distribution, metabolism, excretion is pharmacodynamics, pharmacokinetics, pharmacotoxicology, pharmacovigilance. The correct answer is option B, pharmacokinetics. Pharmacokinetics describes the journey of a drug through the body. Which of the following is a controlled release dose form? Capsule, tablet, transdermal patch, syrup. The correct answer is option C, transdermal patch. Transdermal patches release drug slowly over a prolonged period. The term placebo means Active drug, inactive substance, toxic drug, stimulant. The correct answer is option B, inactive substance. A placebo has no pharmacological effect and is used in controlled studies. The phenomenon of increased drug effect due to repeated doses is tolerance and sensitization. Sensiti- Dependence, resistance. The correct answer is option B, sensitization. Sensitization, reverse tolerance means increased responsiveness after repeated drug exposure. The cumulative effect of drug occurs due to rapid excretion, slow metabolism, quick absorption, enzyme induction. The correct answer is option B, slow metabolism. When elimination is slower than the dosing, drug levels accumulate in the body. The drug which causes harm to fetus during pregnancy is carcinogen, teratogen, mutagen, allergen. The correct answer is option B, teratogen. Teratogenic drug causes developmental defects in the fetus. The main organ for excretion of drug is liver, kidney, skin, intestine. The correct answer is option B, kidney. Most drugs and metabolites are excreted through urine. Drugs that cross blood-brain barrier are lipid soluble, water soluble, ionized, large molecules. The correct answer is option A, lipid soluble. Lipid soluble drugs easily pass through the blood-brain barrier to affect the brain. Enzyme inhibitors cause